Torus aorticus is an impression in the cavity of right atrium. The germ cells are derived from yolk sac endoderm. Which one of the following cell of germinal epithelium of testis divides by meiosis, primary spermatocyte? The results of the fertilization include the following except acrosome reaction. So, what is the results of fertilization? Restoration of diploid number of chromosome, determination of sex, and initiation of cleavage. Which one of the following muscle does not develop from the second pharyngeal arch? Tensor palatini does not develop. And which muscles develop from second pharyngeal arch? Posterior belly of digastric, stapedius, and stylohyoid. In hydatidiform mole, blood cells does not develop because of defect in mesoderm. Defect in any of the following may result in renal agenesis except failure of descent of nephrogenic tissue of lumbar area. So, what are uh, defect in nephrogenic bud, ureteric bud, or blastoma of nephrogenic tissue may result in renal agenesis. Appendix of epididymis is a remnant of mesonephric duct. Fourth ventricle develops from rhombencephalon. Third ventricle develops from diencephalon. Axillary sheath is derived from prevertebral layer of deep cervical fascia. Bare body is found in which phase of cell cycle? Interphase. Meckel's diverticulum is a remnant of vitello-intestinal duct. Polar bodies are formed during oogenesis. Nucleus pulposus is a remnant of notochord. Vitelline vein forms portal vein. Ductus deferens is derived from mesonephric duct. Somites are derived from paraxial mesoderm. Primordial germ cell is derived from ectoderm. Most common site of ectopic pancreatic tissue is stomach. The outer layer of the blastocyst formed trophoblast. The embryological first pharyngeal arches remains phenomandibular ligament. Forelimb bud appears on 26 days. Primitive streak is initiated and maintained by nodal gene. Ureter develops from mesonephric duct. Regarding sexual differentiation of the fetus, gonadal development begins at 5th week of intrauterine life, and male sexual differentiation occurs earlier than females. All are mesodermal in origin except dilator pupillae. So, what is mesodermal in origin? Choroid, iris, and ciliary body. All are neural crest derivatives except quada equina. So, what is neural crest derivative? Adrenal medulla, melanoblast, and odontoblast. According to embryologist, embryo is termed till 8 week of fertilization. Preauricular sinus is formed due to improper fusion of auricular tubercle. In ductus venosus, the fetal blood from the placenta reaches to the liver through left umbilical vein. Which of the following is not present at birth? Mastoid tip. Closure of neural tube begins at which of the following level? Cervical region. Following statements are true regarding first pharyngeal arch. Maxillary and mandibular prominences are formed. Maxillary and maxilla and zygomatic bone are formed by intermembranous ossification. Tensor palatii formed by first arch. Spiral ganglion and organ of Corti are fully developed in a fetus by 20 week. The umbilical cord has 2 artery and 1 vein. Ventral mesogastrium derivatives include all except gastrosplenic ligament. So, ventral mesogastrium derivatives include falciform ligament, coronary ligament, and lesser omentum. Meissner and overback plexus are derived from neural crest. All of the following are composite muscle except flexor carpi ulnaris. So, which are the composite muscle? Flexor digitorum profundus, pectineus, and bicep femoris. Paramesonephric duct in male remain as prostatic utricle. Which of the following arteries is derivative of second branchial arch? Stapedial artery. Meckel's cartilage develops from first branchial arch. False statement about fetal development is fetal legs develop before upper limb. Fetus gains maximum weight in first trimester. Both the sentences are wrong. What is true about fetal development? Growth in length is very fast in 3rd to 5th month, and thumbs are formed in pre-axial border, and upper limb develops before legs. Which of the following attains adult size before birth? Ear ossicles. Structure derived from neural crest is melanocyte. Diaphragm develops from all of the following structures except dorsal mesocardium. So, diaphragm develops from which structure? Septum transversum, pleuroperitoneal membrane, and cervical myotomes. Muscular component of dorsal aorta develops from paraxial mesoderm. Which of the following vessels do not carry deoxygenated blood in fetal circulation. Umbilical vein. What is the embryological remnant of the median umbilical ligament? None of these. Derivatives of urogenital sinus include all except ejaculatory duct. So, which are the derivatives of urogenital sinus? Bladder, membranous urethra, and prostatic urethra. Derivatives of mesonephric duct are all except rete testis. So, which are the derivatives of mesonephric duct? Ductus deferens, seminal vesicles, and epididymis. Cranial end of Wolffian duct forms epiphoron. Cardiac septum develops by 5th to 8th week. Umbilical cord contains one vein and two arteries. Remnant of mesonephric duct are all except Bartholian duct. So, which is the remnant of mesonephric duct? Paraupophoron, epiphoron, and Gartner's duct. Renal agenesis is due to defect in ascent of metanephron, defective formation of nephritic tissue, and defect of the ureteric bud and mesonephros. Which of the following is true about vertebral development? The sclerotome surrounds the notochord and the neural tube. After first meiotic division, the primary oocyte remains arrested in diplotin stage. Double aorta occurs due to persistence of distal portion of the right dorsal aorta. Pharyngeal tonsil develops from which pharyngeal pouch? Second, during the third week of human embryo development, primitive streak formation occurs. The upper three-fourths of vagina develops from Mullerian duct. Rectum develops from cloaca. Skeletal derivatives of second pharyngeal arch is stapes and maxilla. Umbilical cord contain two arteries and one vein. All are derived from neuroectoderm except lens vesicle. So, what is derived from neuroectoderm? Dilator pupillae, optic nerve, and posterior layer of retina. Bladder develops from endoderm. Development of labia majora is from genital swelling. All develop from the hindgut except ascending colon. So, what is developed from the hindgut? Descending colon, sigmoid colon, and rectum. Myoblast of diaphragm develops from which somite? Cervical 3 to 5. Primordial germ cells are derived from yolk sac endoderm. All are derived from ectoderm except eustachian tube. So, what is derived from ectoderm? Lens, spinal cord, and retina. Tongue muscles are derived from occipital somite. Development of peritoneal cavity is from intraembryonic coelom. Cryptotrophoblast invades D. basilis. Embryological development of the human vertebrae is from somite. Endodermal cloaca gives rise to all of the following except lower of anal canal. Embryogenic period of development is up to 8 weeks. Which of these is correct about development of tonsil? Develops from the second pharyngeal pouch. Which of the following is derived from endoderm? Gallbladder is derived from endoderm. Small intestine develops from midgut. What is derived from Wolffian duct? Appendix of epididymis. Artery of second pharyngeal arch is stapedial artery. Umbilical cord has two artery and one vein. Single unit smooth muscle are seen in ureter. Second arch derivative is stapes. The outer layer of the blastocyst forms trophoblast. Implantation occurs at 6 to 7 days. Double aortic develops from right dorsal aorta. Mesodermal in origin is microglial cells. Which of the following is derived from ectoderm? Epithelium of iris. Which of the following are derived from mesoderm? Microglial cells. What now histology? What best characterizes the sinusoids? They are not found in skeletal muscles. Select the statement which best characterizes lymph capillaries have a discontinuous basement membrane. Which of the following cells contain organelles needed for the secretion of a proteinaceous product? Pyramidal cells of the pancreatic acini, chief cells of the stomach, and serous secreting cells of the parotid gland. The ureter is lined by transitional epithelium. Juxtaglomerular apparatus or JG cells are smooth muscular cells of different afferent arteriole. Duct of Bellini are found in kidney. Haversian system is seen in cortical bone. Orbac plexus is present in colon, esophagus, stomach, and small intestine.